It is 2 minutes past the hour right now. We heard a lot from the Surgeon General over the last couple of weeks. He says if people continue to social distance, we could see a light at the end of the tunnel at some point in the next 30 days. U.S. Surgeon General Jerome Adams joins us now live this morning. Good morning to you. Thanks so much for your time. I know it's precious these days.
Well, it absolutely is, but I do want to share my uplifting message. Good day, D.C., and I want to give a shout out to all the healthcare workers out there. I just got off a phone call with the chief surgeon at NYU in New York City on the front lines, and he just shared with me how people are really going above and beyond to take care of the patients that are coming in these hospitals, and there is a light at the end of the tunnel. We are seeing in New York and New Jersey, cases are slowing down. Hospitalizations are actually going down, and it's coincident with people starting aggressive social distancing and mitigation about 3 weeks ago. So I want people to know that if you do these things, they actually do work. We have proof that they're working right here in the United States, and now is the time for us to double down on our efforts, because the more we do it, the fewer people will be hurt, and the quicker we'll get out to the other side.
Dr. Adams, I want to talk to you about medical personnel in just a few minutes because I know that's very close to your heart. I want to get through as much as we can in a few minutes here. You said 3 days ago that this would be the hardest and saddest moment in most Americans' lives, our Pearl Harbor moment, our 9/11. Do you still believe that?
Well, I believe that this is going to be a memorable moment, something that people will tell their grandkids about. But we know that after tragic moments in history, America's really galvanized. Pearl Harbor was a tragic moment, but it was also a moment when America finally got involved in the war and said, hey, we can do this. And then you have Rosie the Riveter, you have people all over the country doing amazing things to support those who are out there on the front lines. And that's what we need right now. The most important thing that everyone can do and know is that this disease spreads person to person. And the way we protect our healthcare workers is by not getting sick in the first place, not giving this disease a chance to spread by staying at home.
You just mentioned that light at the end of the tunnel, the hope that people are looking for. We've seen other countries flatten their curve, and you even mentioned in many cases through aggressive mitigation efforts. Are we being aggressive enough here? And if not, what's the next step?
Well, we know that 90% of people across the country, when you look at cell phone data and when you look at polling, are actually staying at home. They're actually doing the right thing. And I would just say to the 10% out there who aren't, please understand that the way we defeat this disease is at the community level. The public has the power to change the trajectory of this epidemic.
You are tasked, not just as Surgeon General, but with the White House Task Force to look at things on the big scale, on the national scale, to protect everybody in this country. Let's go local for a minute. You're a D.C. area native. You're from Southern Maryland. You know as much about this area as anybody. One of your fellow task force members labeled D.C. as a potential hotspot for new cases. Do you agree with that? Do we have to do things differently here than maybe some other places?
I agree D.C. is a hotspot. We know that urban areas where people particularly travel back and forth between New York City, between Europe, between China, the previous hotspots are ripe. We also know, and you've heard us talk about this recently, even though I've been talking about it for weeks, African Americans are at higher risk for complications from COVID-19, and we know we have a higher proportion of African Americans in the PG County area, in the D.C. area. So we very much need to pay attention, but we also should know that Washington and California were the original hotspots, and they were able to flatten their curves. So we know we can save lives if people do the right things, including following these 30-day guidelines that we put out from the task force.
You put the guidelines out, you've put the guidelines out, you remind people about the guidelines, and then last weekend you see things like what was happening at the fish market in D.C., and I know you saw it, everybody in the country saw it, and it put D.C., quite honestly, in a bad spot. So what do we have to do to get the message through?
Well, I think more people are starting to get the message because they're seeing friends, family members, colleagues coming down with COVID, and some of them unfortunately dying. I've tried to be both inspiring and uplifting, but also letting people know the deadly seriousness of this disease. We need to connect with more of our social media influencers and our sports stars. And I love that the Good Day folks are doing that, because at the end of the day, some people out there just aren't going to listen to the Surgeon General, including my kids, but they will listen to Kylie Jenner. They'll listen to Kevin Durant. They'll listen to the Nationals and to the Wizards and those folks out there telling them to stay at home. So that's what we need more of.
And I mean, no disrespect to your position, but they might not listen, at least some, to the Surgeon General as a person in Washington, as a politician, but maybe they'll listen to Jerome Adams, the doctor. How bad could it get here?
Well, we know that projections have high ends and low ends. And you heard just a week ago people talking about the possibility of 1 million people dying. But we've seen that America really has stepped up above and beyond what we could have ever even anticipated. And now those projections are much lower. but everyone's going to be on a different part of their curve. DC is going to look different than New York, is going to look different than California. In DC, the DMV, we have a chance to determine our own outcome. It is up to you. I love the fish market. I love seeing the cherry blossoms, but this is the year, this is the time to stay at home so that we can get through to the other side and reopen sooner.
Couple things real quick. One on the national level. I know it's tough to battle something that we never dealt with before, but there was intel that it could be as bad as it is now. So did we act soon enough as a nation?
Well, instead of focusing on what happened in the past, I'm more focused on what's happening going forward. And I think that's what we need to do right now. There'll be plenty of time to look back. There are plenty of lessons learned. This is unprecedented. But I think we really need to help America understand that by following the 30-day guidelines, by going to my website and figuring out how you can make a cloth facial covering if you do have to go out, by helping them understand that staying 6 feet away is critically important, that we actually have the power to change the trajectory of this epidemic moving forward, and then we'll plan on what we need to do for the next epidemic.
We're starting to see more local municipalities, Montgomery County, Maryland being one of them, looking at potentially having anybody who's still working, the grocery store workers, et cetera, wearing masks to make that a requirement. Do you have any take on that?
Well, the CDC recommendations are that if you're going to be closer than 6 feet to your nearest neighbor, then it is a recommendation. And in the grocery store, it's hard to maintain that distance. So I don't think it's a bad idea for people to consider. Just remember, you're protecting other people by wearing your mask. Also remember that you need to wash your hands before you put it on so you don't contaminate yourself. And finally, it is not a substitute for social distancing. Just because you have a face mask or a cloth facial covering on doesn't mean you can go out to the fish market or go out around other people, because this virus spreads person to person. The way you defeat it is by separating people.
I know you're passionate about your fellow medical professionals. I promised you I would ask, but it also seems, at least online, you might be a little frustrated that the personnel, the resources might not be getting where they're needed the most. There are quite honestly some doctors that are not working right now that probably could be. Can you do anything on the federal level to help that out?
Well, we're trying to do all we can by talking with governors, talking with hospital associations. Again, I'm calling up my colleagues constantly to try to reallocate and redistribute resources at the local level. And you're right. I hear all the time about colleagues who are overworked and overwhelmed and can't get PPE. And then I hear about colleagues who are saying they sent me home yesterday because they don't have enough work for me to do. There's a tremendous mismatch, but that mismatch gets corrected at the local level. We can't solve this from Washington, D.C., but we can provide the support and the guidance to people to help them figure out how they can find out where this capacity actually is.
And finally, Dr. Adams, I know you're not a prognosticator, but you do have some research. We did promise some viewer questions, and we did get one from someone who said on a, I don't want to say lighthearted note because she's getting married in September, but she wants to know, are things going to turn around by then? Can I plan a wedding in September? Can I plan to get back to normal life? Do we have any better idea of a time frame?
Well, one of the things I would say is if we all do the right things, I feel pretty good about us being back to some semblance of normality, definitely by September. But it's also important to know that this is going to be a new normal. We're still going to have to pay close attention to frequent hand washing and hand hygiene. At that point, we still may have to make sure we're not crowding too much in places. There will be a new normal, but I feel pretty good about planning a wedding in September. So I would say go ahead and go forward. We do have to think about how we continue with life, how we remain healthy while we're social distancing right now, and part of that is making sure you have things to look forward to.
Dr. Adams, I know you have to get back to the White House. We do appreciate your time. I know it's precious, as I mentioned off the top. Look forward to keeping in touch, though, and thanks so much for joining us this morning.
Thank you, and keep it up, D.C. You all are doing the right things. We just need to stay at it, and we'll get through this.
It's good advice from the top. Surgeon General Jerome Adams. Thanks much. Aaron?